Welcome to Medicine Information Factory YouTube channel. Today we shall discuss about bempedoic acid. What is bempedoic acid? Bempedoic acid is an oral prescription medication used to lower bad cholesterol, specifically low density lipoprotein cholesterol. Approved by the FDA in 2020, it represents a new class of lipid-lowering treatments. It is primarily prescribed for adults with high cholesterol who need extra help reaching their target levels, or for those who cannot tolerate standard cholesterol medication. How it works. Like statins, bempedoic acid works by telling the liver to produce less cholesterol. When the liver produces less, it responds by pulling more LDL cholesterol out of your bloodstream. However, there is a major difference in how and where it operates. The mechanism: it inhibits an enzyme called ATP citrate lyase, which sits just one step upstream of the enzyme that statins block. The liver-specific advantage. Bempedoic acid is a prodrug, meaning it enters your body in an inactive state. It can only be switched on by a specific enzyme that exists in the liver but is completely absent in skeletal muscles. Because it cannot activate in your muscles, bempedoic acid drastically reduces the risk of muscle aches and weakness, the most common side effect that cause people to stop taking statins. Who is it for? Doctor typically prescribe bempedoic acid in a 180 mg once daily tablet for statin intolerant patient, people who experience severe muscle pain or other side effects for statins. Maxed out therapy, patients already on the maximum dose of a statin who still have not reached their goal LDL numbers. Genetic high cholesterol. Adults with heterozygous familial hypercholesterolemia, an inherited condition causing aggressively high cholesterol. It is also commonly sold in a combination tablet with the ezetimibe for an even stronger cholesterol-lowering effect. Effectiveness and benefits. LDL reduction taken alone, it typically lower LDL cholesterol by about 50% to 25%. Cardiovascular protection. Clinical data has proved that bempedoic acid successfully reduces the risk of major cardiac events like heart attacks and strokes in high-risk patients. Inflammation. It has also been shown to lower high-sensitivity C-reactive protein, a key marker of cardiovascular inflammation. Side effects and risk. While it bypasses the typical muscle issue of statins, it does have its own specific safety profile to watch out for. Hyperuricemia and gout. Bempedoic acid can clear out the body's ability to excrete uric acid. This causes a buildup in the blood, which can trigger out attacks, painful swollen joints. Tendon rupture. A rare but serious side effect is an increased risk of tendon tears or ruptures, such as the Achilles tendon, shoulder, or biceps. The risk is higher for those over 60, people taking steroids, or patients with a history of tendon issues. Drug interactions. It can increase the concentration of certain statins in your blood if taken together, most notably simvastatin and pravastatin. Doctors usually lower the doses of those specific drugs if pairing them with bempedoic acid. Uses in pregnancy and lactation. When it comes to pregnancy and lactation, the medical consensus on bempedoic acid is highly precautionary because it is a relatively new drug approved in 2020 and works by directly altering how the body handles cholesterol. It is generally not recommended during these periods. bempedoic acid in pregnancy. The official guidance for the FDA is that bempedoic acid may cause fetal harm and it is typically discontinued as soon as pregnancy is recognized. Why it poses a risk? The mechanism: bempedoic acid stops the body from synthesizing cholesterol. While that is great for your arteries, a developing fetus requires large, steady amounts of cholesterol and related fats to properly build cell membrane, synthesize essential hormones, and some healthy organ and brain development. Lack of human data. There are no adequate, well-controlled clinical trials of bempedoic acid in pregnant women because scientists cannot ethically test it on pregnant mothers. The exact risk level in human is unknown. Animal studies, high doses given to pregnant rats and rabbits during testing led to lower fetal birth weights and structural skeletal changes. The medical context: for the vast majority of people, high cholesterol is a long-term health issue, not an immediate emergency. Pausing cholesterol medication for the 9 months of pregnancy usually has no meaningful impact on a woman's long-term cardiovascular health. Bempedoic acid and lactation. The FDA and drug manufacturers state that breastfeeding is not recommended while taking bempedoic acid. What the data shows: excretion into milk. Recent clinical lactation data shows that bempedoic acid does passes in breast milk, although in very small amount. The concern for the infant: even though the amount in infant drinks is very low, the drug's mechanism remains concern because it disrupts cholesterol synthesis. There is a theoretical risk that it could interfere with the normal rapid lipid development required by a growing infant. Because of these unknown risks and potential for adverse effects on the baby, healthcare providers advise either stopping the medication while nursing or using alternative methods to feed the child. Safer alternatives: if cholesterol management is absolutely critical during pregnancy or breastfeeding, doctors will look to alternate treatment. Bile acid sequestrants, medications like colchicillin or cholestyramine are often considered the safest alternatives. These drugs work entirely inside the digestive tract to bind cholesterol, meaning they are never absorbed into the bloodstream and cannot reach the fetus or enter breast milk. Always consult your obstetrician and cardiologist to safely manage your cardiovascular health and medication timeline before or during pregnancy.